Well, now that winter's around the corner, it's not as easy for us to get outside. So how do we stay active and safe too during a pandemic? Aimee Donnelly is the wellness coordinator at Network Health. She has recommendations for exercising. Hey, Aimee.
Good morning, Molly.
Good morning to you. Great to see you all smiley there. I like that. Let's talk a little bit about being active, because I think especially during this pandemic, being able to be outside means so much to people. And I think we start to worry when it gets colder outside and people worry about the snow and the sleet and ice.
Yes, definitely. COVID and the winter coming up is really putting us in for a doozy. But there's so much that you can do to stay physically fit and get your exercise in at home.
So,
Um,
yeah,
oh,
so I'd love to know any recommendations you have. So like certain exercises that you would suggest.
Definitely. So you do not need fancy equipment. So don't rush out to the store and buy things. Use things around your house. If you have canned food or those empty gallons of milk or laundry detergents, fill them up with water. You can use those for weight training. If you have a backpack, you can put your books in it and wear it on your back while you're doing some exercise. Use your stairs. Another nice thing is virtual. Everything is virtual now. There's a lot of great apps you can download for free. And YouTube has a lot of great videos. And most of our Medicare members do have silver sneakers included in their insurance plans. Silver Sneakers is now offering free virtual classes. So any age group is able to exercise and stay fit at home.
Yeah, I'm impressed actually with what's available now as we go online and try to get tutorials or classes or
Yes.
things like that. So I think that's a great point. And I wonder if there are certain exercise recommendations that you would make, things that we should take into consideration.
Definitely. So the American College of Sports Medicine and the CDC actually recommends that we get 150 minutes of moderate intensity exercise. Don't let that number scare you. You can break it up throughout the day. So you can do 10-minute sessions, 5-minute sessions, whatever fits your schedule. Just a few things to remember is that 150 minutes is the baseline. If you want to see more improvements in your health, you want to do more than that, especially if you're trying to lose weight. And also, you have to do a variety of exercises. Don't just stick with cardio. It's important to do strength training, flexibility, and some mindfulness activities too.
Well, speaking of the mindfulness part, I'm glad you brought that up, because we all know that exercise is good for our physical health, but there are
Definitely.
other advantages, benefits for us when we exercise, right?
Yes. Oh my. So it's not just physical. That's what everyone thinks, but it is great for your mental health. It will help reduce stress and it will actually make you feel happy, make you feel much better. It will improve your sleep and it can also help reduce chronic and different health conditions and diseases. So exercise helps with everything.
Exercise is key. It's such a great
It is.
point. Um, Exercise and perhaps being outside, a lot of people worry about falling or accidents that might happen as a result of exercising. And I wonder if there are certain things that you recommend to sort of avoid those types of falls and accidents.
Yes, unfortunately, falls can happen to anyone. None of us are safe from them, but we can take the steps to make yourself a little less apt to falling. So, have really good shoes that fit well. If you need mats around the house, especially in places like the bathroom that will help with non-slip, please put those. But watch out for the rugs that do curl up because that can help make you trip and fall in your living room. Keep things off the floor. I know it can be hard if you have children or grandchildren, or if you might just have a lazy day and you're throwing stuff on the floor, but that is a hazard. Make sure you have really good lighting in and throughout your house. So maybe adding a few lights here and there will help you. And another thing people don't think about is your medication. Certain medications can increase your risk for falling. So, our network health insurance members, we have staff pharmacists that they can talk to about their medications to make sure that they're not at risk for falling while taking those.
I'm glad you said that, Aimee. I've actually never heard that before, that certain
Yeah.
medications put people at risk for falling. So it's such a
Mhm.
great point of education there. I appreciate that.
Yeah.
In terms of people falling, if it happens, how do you support people?
Definitely. Network health insurance has a lot of great offerings for our members. We have Stepping On, which is a class that is offered now virtually. We have a lot of great educational pieces in our blogs and newsletters. So if members enjoy reading, that is a great way they can educate themselves on falls and fall preventions. Two other great offerings we have is members have the options to talking to a case manager or staff pharmacist about their medications, or to set goals to prevent them from falling. And we give them resources within their community that they can utilize to help achieve those goals. And then lastly, we did partner with a nonprofit program called Finding the Balance for Fall Free Fridays. Try saying that 3 times. We do give virtual lectures through that. So we offer a lot of great resources, especially in this virtual age. We're able to reach a lot of people, and you can find that on our Facebook page or networkhealth.com.
Wonderful. Thank you so much, Aimee, for joining us. I appreciate it.
Yeah, have a great day.
You too. And you can find out more about Medicare Advantage plans as well as comparing different plans if you visit the website that Aimee just mentioned. It's networkhealth.com.